Well, Lou, thank you very much. I appreciate it, and I appreciate all you've done. Um, I want to spend just a few minutes helping to place in context what VA is. VA is the largest provider of oncology services in the nation. 50,000 veterans with cancer, 200 new diagnoses a day. Uh, with large numbers of prostate cancer and lung cancer. And really, our whole concept is to recognize the fact that the 19 million veterans, of which 9.5 million of them are enrolled in VA healthcare, have taken an extraordinary toll for this nation. Some of that toll, a price of their service, has been increased risk of cancers. Prostate cancer especially affects 13,000 new veterans a year, 7,700 new lung cancer patients. And we can debate all the reasons these things happen and what the exposures were and what the smoking rate is, whether it was Agent Orange exposed. But the work that we've done with you, Lou, really has been to try and place veterans at the front of the line in seeking care, as well as being provided the most advanced care in the nation. But precision oncology, and the reason I'm so impressed with it, is that it gives us a chance to do the genetic markers on the tumor and then really tune therapy into the genetic mutations that we found. Very large numbers of our prostate and lung cancer patients have mutations that are potentially treatable. Unfortunately, today in America, there's very few FDA-approved drugs for those genetic mutations. And the whole effort here, if we are to be successful, is to drive the number of FDA-approved agents upwards so that when a veteran, or frankly any American, finds out that their tumor has some sort of genetic mutation that is potentially treatable, that there's a drug for that. And that's the whole effort here, and I'm so proud of the ability of our team to really get behind this. And I'm going to introduce you to one of those great researchers and clinicians, Dr. Ken Myrie, who's leading this effort. Ken?
Hi, I'm Dr. Ken Myrie. Precision oncology has revolutionized cancer care by tailoring it to the characteristics of the patient and of the cancer. VA cares for many veterans with cancer, and many of those men and women live in rural areas. Part of our commitment of creating a system of excellence for precision oncology care is to ensure that every veteran, no matter where she or he lives, can get access to the best possible care. The difference between VA and other cancer researchers is that we can research on a much larger scale. With 170 medical centers and over 1,000 community-based outpatient clinics, as well as the strength of our affiliations with top medical centers, many of which are NCI-designated cancer centers. Our Oncology Program Office has democratized access to both advanced molecular testing and to expert care through the Tele-Oncology Program. We are working to fully leverage that scale by building networks to advance research. For example, the Prostate Cancer Analysis for Therapy Choice Network, or PATCH, is bringing together a number of VA medical centers to take an umbrella approach to trials, focused on targetable genetic mutations in prostate cancer. One of those trials, called BRACE, is evaluating the efficacy of carboplatin versus olaparib in veterans with resistant prostate cancer containing homologous recombination repair deficiency. In addition to clinical trials, we're using artificial intelligence to identify predictive markers for diagnosis, prognosis, therapeutic response, and patient stratification. Together, active collaborations among investigators across the entire research enterprise are leveraging all of VA's strengths to transform VA into a system of excellence in precision oncology care. Thank you, and now back to Dr. Stone.
So Ken, thank you very much. I appreciate it. And you know, I think one of the things that we're most unique in at the VA is the fact that we have a lifetime responsibility to our patients. And I'm not denigrating in any way the relationship that you all have with your patients. But when veterans are assigned to us, coming out of uniform, we have them for the rest of their lives. It's not like they go to another insurance plan or to something else. So we might have 40, 50, 60, 70 years of care with them. And as such, our ability to really do what we call integrated medicine, where we are able to take that patient's comorbidity and control it, makes huge differences in the outcomes of patients' cancers. Let me give you an example of that. We did a study on black males with prostate cancer, and as you all are well aware, black males with prostate cancer have a higher mortality rate from their prostate cancer than other ethnic groups in the nation, except in one subpopulation, and that's the VA. The VA actually erases that ethnic disparity and that higher mortality rate. And it's not because we know how to do prostate cancer therapy better than anybody else. It's because we control the comorbidities. It's because we control the diabetes, the hypertension, better than a non-integrated healthcare system. And it's one of the things that we're most proud of is this erasure of a lot of the ethnic disparities that we see in the nation in other parts of our delivery system. And all of this work would not be possible if it wasn't for the Secretary's Center for Strategic Partnerships. That Center for Strategic Partnerships has brought an integration with the Prostate Cancer Foundation, who has committed $50 million to helping us build prostate cancer centers of excellence. Also, IBM Watson and its use with artificial intelligence has allowed us to really develop a great amount of information regarding more than 2,700 veterans that we've taken a look at with various problems, including advanced lung cancer. What I'd like to show you now is a very powerful video. And that video really tells the unique, intimate story of a veteran with advanced lung cancer.
It was less than a year when I retired out of the Army till I got diagnosed with cancer. It was stage 4 lung cancer. It had metastasized to pretty much everywhere. Bone, brain, spine, lymph nodes, pretty much, everywhere.
It was off-the-shelf chemotherapy, not designed specifically for him. And, he was doing okay, but he was having significant side effects from that.
You get the intravenous chemo treatment, and so you just feel like someone beat you up and stepped all over you for about a week, and then you start to recover, and then you get to normal, and then it happens all over again.
Turned out that he had a cancer mutation that we had a drug for that was able to be tailored specifically to the type of mutation that he has. And we were able to stop his chemotherapy and start him on that drug. That, I think, is what resulted in his both improvement in his tumor and a reduction in his side effects. So this is targeted therapy.
The medicine is a lot less harsh, much less side effects. So it allows me to spend more time with my family, support my family, spend time with my kids.
The VA is a national healthcare system. To be able to take care of patients at that scale, you need to do something that is more facile and robust to be able to provide the same level of excellence to so many patients all at the same time. The interpretation is the hard part, actually, in my opinion. And what we use IBM Watson to help us do is to bring knowledge focused on this patient's results, to interpret it in the best way that we can based on the patient's tumor type and what drugs might be useful to treat that patient's tumor. To be able to interpret the results of those genetic tests, we need different technologies, and we need those technologies to work very quickly.
It's patient-physician relationship and the implementation of all that tremendous information that's gathered by programs like Watson that help to, provide the information to the clinician.
When faced with very difficult discussions about the bad news that I had to deliver to them, would look me in the face and say, what can I do to help someone else? That's really powerful, to have them say, this is something that I know is going to be bad for me, but I want to make the best of it, and I want to think about other people doing it. That's really powerful.
What you've just seen is a very powerful video, and there's none of us that are not moved in watching it. You'll hear more from Dr. Kelly later in this program, and I appreciate the leadership role that Dr. Kelly has had for us. And now I want to turn to another relationship that we have, another partnership. Through an extraordinary gift from Sanford Health, we have been able to leverage care and testing in an extraordinary manner. And I want to introduce you to another veteran, Pat McGuire, whose extraordinary story you'll see next.
I was the head miller for a house sautry. They sell breaders and stuff like that, and I milled the corn. I was the head miller. I got a bad cough one day from just some dust that was flying around, and I went home and just coughed real bad and hurt, and I coughed up some blood, and that was the red flag for me. And so I go and get a PET scan. I was driving home. My doctor called me, and that's when he told me I had stage 4 lung cancer with metastasized in my head, my brain, and had 5 tumors in my brain, 4 in my lungs, 1 on my adrenal gland, which is the one I still have left, but that's about the size of what the cancer was. I served in the Navy for 4 years, from 1992 to 96. And I was on board the USS Phoenix, SSN 702, out of Norfolk for 3 years.
Mr. McGuire has been through a lot. As we now look out beyond his cancer and think about how to support him, that's where I think this type of testing is really going to make a big impact. So a patient would go to their local VA where the blood would get drawn, would get handled in a facility like the one that's behind us, packaged up and shipped to Sioux Falls, South Dakota, where the Sanford Imagenetics laboratories will analyze that data and then report back to that facility the genetic information for that individual patient, where it then would get incorporated into the patient's electronic health record and made available to each of their providers so that genetic test results are available before they start a prescription, so that we can make those better decisions in real time.
When I was deployed to Afghanistan as part of the Army, we were working with the British. The British knew that there was percentages of their population that would respond to Tylenol at the same rate as would respond to morphine. Imagine the ability to predict in advance what a soldier might respond to with a catastrophic injury. When we think about the relationship of our healthcare system and the VA to the American veteran for their entire lifetime, the ability to sustain that genomic work and then predict for them something that could have, in chronic disease, a lifetime of effect is very, very exciting.
I believe that this is going to help a lot of people, all because they're doing this testing. I think I've still got so much left to give.
I hope that at the conclusion of this program, we'll be able to expand testing to even more veterans so that even more of them can get the benefits of the testing, and we can give back to them in the way that they gave to us.
More than 1,000 veterans have now been tested through this great partnership with Stanford Health. But now I want to turn to our relationship with the Bristol Myers Squibb Foundation, who, through a gracious grant, have provided $4.5 million to the VA to expand our tele-oncology program. You know, more than half of veterans in America live in rural communities or highly rural communities, that getting to a specialist, especially an oncology specialist, can take up to 3 hours of drive time. It's just an untenable situation. And because VA is an extraordinary leader in telemedicine, providing more than 2 million telemedicine visits a year, we have developed through this grant a number of oncology hubs that we are expanding across the nation in order to allow even a highly rural veteran to receive exactly the same care planning and care execution that does a veteran who might live right next door to one of America's premier academic medical centers. It's an extraordinary story, and we're incredibly thankful of this partnership. We're very, very proud of what we've put together at VA to really serve America's veterans, and we invite you to think about how you might be part of that. Catherine has two of our great clinicians that will talk further on this, and we look forward to the next time we're together. Thank you.